Imagine walking into a doctor's office with this uh, just devastating, essentially untreatable skin condition,
Hmm.
like a condition that makes it painful to move, to sit, to even be intimate. And instead of the doctor just handing you a tube of standard issue steroid cream to, temporarily numb the pain.
Right, which is the usual go-to.
Exactly. But instead, they look at you and say, we aren't going to just manage your symptoms. We're going to take some fat from your stomach, spin down your blood, and use your own biology to literally reprogram your local immune system and rebuild this tissue from scratch.
Yeah, it's wild. It sounds like complete science fiction.
It really does. But, I mean, in the cutting-edge world of autoimmune and regenerative medicine, that leap from playing defense to actually regenerating biological tissue, that is exactly the reality we are witnessing right now.
It absolutely is, yeah. And that is our mission for today's deep dive. We are looking at a stack of recent medical literature, systematic reviews, and clinical case studies to uncover this massive paradigm shift in how medicine is treating a heavily misunderstood, incredibly painful chronic condition called vulvar lichen sclerosus, or VLS.
And, the through line in all these sources is a total departure from how we viewed chronic disease management.
Right.
For decades, the medical approach to VLS has been purely defensive.
Yeah.
It was all about suppressing the inflammation, just stopping the damage.
Using out the fire.
Exactly.
Yeah.
But today we are looking at how researchers and doctors are using a patient's own spun blood and harvested body fat to actually reconstruct damaged architecture from the ground up.
Which is just incredible. And look, if you're listening to this and you've ever dealt with an autoimmune issue, you know how frustrating it is when doctors just try to suppress your whole system and manage the crisis.
Oh, absolutely. So whether you are a medical professional or someone dealing with a chronic condition yourself, or just, a curious learner fascinated by the human body's hidden healing mechanics, this deep dive is going to change how you look at your own biology.
Yeah.
It is a masterclass in how modern medicine is turning the body into its own repair kit.
It really is a game changer.
Okay, let's unpack this. Before we can truly appreciate how the body repairs itself, we have to understand the specific wreckage we are dealing with. Like, what exactly is breaking down in VLS?
Right. So to start, vulvar lichen sclerosus is a chronic inflammatory autoimmune skin disorder, and it primarily affects the genital and perianal regions.
Okay.
The physical hallmark of this disease, like the thing that clinicians immediately look for, is that the skin becomes profoundly thin.
Just loses all its structure.
Yes, it loses all of its natural resilience and elasticity. In the medical literature, it's often described as taking on a shiny, smooth appearance. They say it looks almost exactly like cigarette paper or old parchment.
Wow. And the case reports in this stack of research describe a reality that is just agonizing. Like, what does this disease actually look like for the patients experiencing it day to day?
Well, it is entirely life-altering. I mean, we are talking about severe, debilitating itching. Patients suffer from incredibly painful sexual intercourse. They develop severe fissures, tearing, and scarring.
Which just sounds awful.
It really is. And because of the chronic pain and the, highly intimate nature of the disease, there is a massive psychological burden. The literature frequently notes severe anxiety and depression accompanying the physical symptoms.
I mean, that makes total sense. And reading through the clinical reviews, it's clear this isn't just a cosmetic issue or a minor dermatological annoyance. It carries a heavy medical risk, doesn't it?
Absolutely. Having VLS carries an elevated risk of developing vulvar squamous cell carcinoma.
Which is cancer.
Yes, it's a very serious type of skin cancer. So this requires aggressive, effective intervention. It's not something you can just ignore.
Right. So let's get into the microscopic reality here. What is actually happening at a cellular level to turn healthy, resilient skin into fragile parchment paper?
It fundamentally comes down to severe immune dysregulation. Specifically, this destructive process is driven by Th1 cells and something called microRNA 155.
Wait, let's break that down. Th1 cells, those are white blood cells, right?
Yes, they are. And normally they are a critical part of your immune defense.
Okay.
But in VLS, they are manipulated by microRNA 155, which acts as this master regulator of inflammation in the body. You can think of it like the body's internal messaging system receiving a corrupted software update.
Oh, I see.
It goes completely rogue. And because of this corrupted signaling, the body produces autoantibodies that mistakenly identify a crucial healthy protein in the skin as a foreign threat.
And they attack it.
Exactly. That protein is called ECM1, or extracellular matrix protein 1.
I love a good visual for things like this. So if the skin is a building, ECM1 is the essential structural scaffolding.
Perfect, yes.
When the immune system attacks it, the building doesn't just catch fire, which is the inflammation. The actual walls collapse into fibrosis. The structure itself is just ruined.
If we connect this to the bigger picture, you can immediately see why the traditional treatments have struggled so much. Because the scaffolding is broken, simply putting out the fire isn't enough.
Right, the building is still collapsed.
Exactly. Now, the current gold standard for treating VLS is the application of high-potency topical corticosteroids.
The steroid creams.
Yes. And while that remains a vital first line of defense to stop the acute immune response, it has severe limitations.
Wait, if steroids are just a bucket catching the water from a leaky roof, why are they still the gold standard? Is it just because they're, I don't know, cheaper and easier to prescribe?
Well, cost and accessibility are definitely factors, but it's mainly because when you are dealing with a roaring fire of inflammation, you really need to extinguish it immediately to prevent further damage.
That makes sense.
Steroids do that very well for a lot of people. However, the sources note that many patients are what we call refractory.
Meaning they just don't respond.
Right. Their immune system simply doesn't respond to the steroids at all. The disease just keeps progressing.
And even for the patients who do respond, I mean, the steroids only manage the symptoms. They don't rebuild that ECM1 protein. They don't reconstruct the scaffolding.
Precisely. The sources also mention other symptom management treatments for these refractory patients. Things like UVA1 phototherapy to try and modulate the skin's immune response,
Okay.
or specialized physical therapy like myofascial release for something called clitoral phimosis, where the damaged tissues actually fuse together.
Oh, wow.
But again, these are defensive maneuvers. You are managing the collapse, not rebuilding the structure.
Okay, so if the scaffolding is broken and steroids just put out the fire, how do we get new scaffolding?
That is the big question.
Which brings us to the first massive leap forward in our sources. Researchers started looking for materials to replace that damaged structure, and the first regenerative material they found is already flowing inside the patient's veins. We are talking about platelet-rich plasma, or PRP.
Yes, PRP.
I've heard this called liquid gold. How are doctors actually getting this and using it?
So the clinical process is remarkably straightforward, but the underlying biology is incredibly complex. A doctor draws a standard amount of the patient's own blood and places it into a centrifuge.
It's a normal blood draw.
Yep. And by spinning it at highly specific, calibrated speeds, they separate the red blood cells from the plasma. What you're left with is this golden serum that is highly concentrated with platelets, growth factors, and cytokines.
Now, let me play the skeptic for a second here.
Sure.
This sounds a bit like vampire magic. Are we sure this isn't just a placebo effect from injecting something, literally anything, into the tissue? Like, why would a concentration of platelets specifically trigger cellular repair in a complex autoimmune condition like VLS?
What's fascinating here is the exact biological cascade that PRP initiates is incredibly targeted. When this concentrated plasma is injected back into the damaged vulvar tissue, it releases those cytokines.
The signaling proteins.
Right. Cytokines are signaling proteins. They essentially shout loud chemical instructions to the surrounding cells. They actively force local cells called fibroblasts to wake up, proliferate, and start laying down new, healthy collagen.
Oh, wow. So it's a direct command to rebuild.
Exactly. And at the same time, the PRP promotes angiogenesis.
Angiogenesis being the creation of brand new blood vessels, right?
Correct. It brings fresh blood supply, oxygen, and nutrients to a tissue that has been starved and scarred.
So even though the PRP isn't directly targeting or replacing that specific missing ECM1 protein, it's basically compensating for that collapsed scaffolding by forcing a massive wave of fresh tissue remodeling.
Yes.
It's bringing completely new construction materials to just bypass the damage entirely.
That is exactly the mechanism. And the clinical evidence backing this up in the literature is very compelling. For instance, the sources highlight a trial by a researcher named Dr. Goldstein. And crucially, this was a randomized, double-blind, placebo-controlled trial.
Which is the absolute gold standard of clinical testing. That means some patients were just getting a saline injection to prove this wasn't just a localized reaction to a needle poke.
Yes, precisely. The researchers also included an analysis by Tedesco involving 94 patients. And in both of these rigorous environments, the study showed significant, measurable relief in the debilitating itching and burning associated with VLS after the PRP treatments.
That is huge for those patients.
Yeah.
Now, the sources do make a point to distinguish between two types of PRP being researched, autologous and homologous. Autologous means it comes from your own body, which makes sense. It's highly safe because your body won't reject its own blood.
Right.
But what is homologous PRP? Where does that come from?
Homologous PRP involves using donor blood. In this specific context, researchers are testing PRP derived from umbilical cord blood.
Interesting. Why umbilical cord blood?
Well, the biological advantage here is that umbilical cord blood contains significantly higher concentrations of anti-inflammatory factors and growth proteins than adult blood. It has an incredibly potent regenerative capacity.
But there's a catch, I assume, since it's foreign tissue.
There is, yeah. Because it's coming from a donor, it inherently carries a slightly higher risk of immune complications or rejection. So while the umbilical cord research is promising for severe cases, autologous PRP using the patient's own spun blood remains the safest and most common clinical approach right now.
Okay, so PRP is the liquid gold. It stimulates repair. It provides the raw bricks and mortar. But what if the environment is so toxic and inflamed that the new collagen just gets destroyed again by the autoimmune response?
Which is a very real problem.
Right. So that necessitates the next advancement we found in the literature. It brings in actual cellular site managers to direct the reconstruction and calm the environment. And surprisingly, these managers are found in human fat.
Yes. We are talking about adipose-derived stem cells, or ADSCs.
How does a doctor actually harness this? They don't just inject raw fat into the skin, do they?
No, it's a highly refined extraction process. The fat is harvested from the patient, usually via a mini liposuction procedure from the thigh or the abdomen.
Yeah.
But they don't use the fat as a simple filler. They process it mechanically or enzymatically to break it down into a liquid nanofat suspension. This creates what's known as the stromal vascular fraction, or SVF.
SVF. Okay, what makes this stromal vascular fraction so magical compared to just regular fat?
Well, it is absolutely packed with cellular heavy hitters. The SVF contains pluripotent mesenchymal stem cells, endothelial progenitor cells, and adipose-resident macrophages.
Okay, pause. For those of us who aren't cellular biologists, we need a translation. What are these cells actually doing in this context?
Fair enough. Think of pluripotent stem cells as the master builders of the body. They are highly adaptable cells that can transform and direct healing based on what the local environment needs. And they do two incredible things simultaneously when injected into VLS tissue. First, just like PRP, they secrete trophic factors and exosomes.
And an exosome is what, exactly?
You can think of an exosome as a tiny biological care package that the stem cell sends out into the damaged tissue.
Oh, nice.
It's filled with genetic information and proteins that promote the building of new blood vessels and support tissue health. But their second action is where the real medical breakthrough happens. ADSCs have a profound immunomodulatory property.
Here's where it gets really interesting because they don't just patch a hole in the tissue. They actively tell the immune system to stand down.
Yes. These stem cells actually interact directly with dendritic cells and T lymphocytes, which are the exact immune cells that are causing the autoimmune riot in the first place.
That is wild.
It really is. The stem cells effectively switch off the T cell surveillance. They reprogram the local immune environment, commanding it to stop the attack on the tissue while simultaneously rebuilding it.
To bring this out of the abstract, there is a deeply memorable case study in the sources that perfectly illustrates this dual action.
Oh, yes, the 59-year-old patient.
Right. It involves a 59-year-old woman. She was dealing with Hashimoto's thyroiditis, which means her immune system was already prone to autoimmune behavior, and she had a severe case of VLS. Her daily reality was brutal. She had a constant burning sensation, severe pain, and the physical exam showed actual fusion of her labia minora. She had 3 distinct 1-centimeter white plaques of sclerotic parchment-like skin.
Yeah, it was a very severe entrenched case where the structural collapse was highly advanced.
Right. So her medical team treated her with a microfiltered, pre-conditioned suspension of her own adipose-derived stem cells. And they combined it with photothermal biomodulation, which is a specific type of laser therapy used to stimulate the tissue and prepare for the stem cells.
Right, to prep the area.
Exactly.
Yeah.
So what was the result of bringing in these cellular site managers?
Over a 5-month follow-up period, her clinical outcome was phenomenal. She experienced completely valid symptom reduction. I mean, the burning and pain subsided.
Which is already a huge win.
Absolutely. But even more amazingly, from a clinical perspective, they saw a visible reversal of the skin sclerosis.
Wow.
Those physical white plaques actually improved. The tissue began to behave like healthy tissue again, and crucially, she had zero side effects.
It proves that by using the body's own stem cells, we can successfully negotiate with a hostile immune system.
Exactly.
So we have PRP, which acts like the construction materials and fertilizer, and we have ADSCs, the fat-derived stem cells, acting as the site managers telling the immune system to back off. Naturally, the next question is, what happens when you put them together on the exact same job site?
That brings us to combination therapy. The theory is that putting stem cells into a highly inflamed area is like planting seeds in toxic soil.
Makes sense.
But PRP acts as the ultimate fertilizer, priming the soil so the stem cells can survive and take over. The landmark study testing this synergy is a milestone prospective pilot trial by a researcher named Gutierrez Ontalvilla. They took 20 patients diagnosed with moderate to severe VLS, and 19 completed the rigorous one-year protocol.
How is the trial structured?
They split them into two groups. The control group received the standard defensive treatment, so high-potency topical corticosteroids. The treatment group, however, received the synergistic combination. They were injected with the nanofat stem cells mixed directly with the platelet-rich plasma.
And the one-year results for that treatment group were striking. The patients who got the fat and PRP mixture saw massive improvements in their physical clinical signs. The severe fissures healed, cervical erosions improved, and the white plaques faded.
Yep.
They didn't just take the patient's word for it either. They took biopsies.
Yeah.
The microscopic tissue samples proved that there was a massive decrease in the inflammatory infiltrates inside the tissue. The microscopic fire was truly out.
It was a huge success. But as with all cutting-edge medicine, the sources do point out a crucial nuance.
Right.
While the inflammation disappeared and the fissures healed, the actual elasticity of the vulvar skin did not significantly improve in that time frame.
That is a really important reality check for anyone reading these studies. It shows the limits of even advanced regeneration. Once that collagen scaffolding has been fibrotic and deeply scarred for long enough, we can stop the damage, we can heal the painful cracks. But returning the skin to its original perfect elasticity is still a massive hurdle.
Which is why researchers are actively exploring a supplementary technique called mesotherapy. This involves highly targeted superficial injections of active substances to specifically support the skin's physical structure after the inflammation is gone.
Oh, interesting.
For example, they are testing heterologous type I collagen injections to help maintain the structural integrity that the missing ECM1 protein used to provide.
It's like bringing in specialized interior decorators after the structural engineers have finished rebuilding the walls. And they're using other materials too, right?
Yes, they are. They are also using hybrid cooperative complexes of hyaluronic acid.
To extend that decorator metaphor, that's like using hyaluronic acid as microscopic sponges to pull water back into the dried-out, parchment-like walls to make them plump and flexible again.
Exactly, trying to win back some of that lost elasticity.
So what does this all mean for the future of autoimmune dermatology?
This raises an important question about where we currently stand in the timeline of medical science. I have to ground this exciting conversation with some clear caveats from the literature.
We have to keep it realistic.
Right. First, these therapies are invasive. They require blood draws and, more significantly, liposuction to harvest the fat. Second, the current evidence, while incredibly promising, is still limited in scope.
Right. We're looking at small sample sizes in many of these pilot studies.
Exactly. Many of the earlier studies lack control groups entirely, or they have relatively short follow-up periods of only a few months to a year.
Which isn't enough to know the long-term reality.
Right. Before this becomes the global standard of care that you can get at any local clinic, the medical community needs large-scale, multi-center, randomized controlled trials. We need to establish clear, standardized clinical guidelines.
We need to know the exact protocols, like how much PRP, how much nanofat, how often. So these don't just remain experimental luxuries for the few, but become accessible, reliable treatments for the countless people suffering in silence with VLS.
Absolutely. The foundational science is undeniably solid, but the rigorous, widespread validation phase is still ongoing.
Still, summarizing the journey of this deep dive is just astounding. We started by looking at a disease that causes the debilitating structural collapse of the skin, turning it to fragile, tearing parchment paper. And the historical answer has been to just aggressively suppress the immune system with heavy steroids handing the patient a bucket to catch the leak. But now we are looking at drawing a patient's own blood, concentrating the platelets, and harvesting belly fat to extract highly intelligent immune-modulating stem cells. We are transitioning from managing a localized fire to actively reversing time and regenerating human tissue.
It fundamentally changes how we view the body's capability to heal itself when given the right highly concentrated biological tools. We aren't introducing synthetic chemicals, we are relocating the body's own repair mechanisms to where they are desperately needed.
For you listening, it's a powerful reminder of the resilience of the human body. Sometimes the most groundbreaking cure isn't synthesized in a massive pharmaceutical lab. Sometimes the answer is hiding right there in our own tissue, just waiting for science to figure out how to properly deploy it.
We are walking around carrying our own advanced repair kits. We just
Mhm.
needed the technology to learn how to open them.
The roof might be leaking, but we finally figured out how to use our own materials to grow new wood. And I want to leave you with a final mind-expanding thought to chew on today. If injecting adipose-derived stem cells into a localized area can effectively reprogram the local immune response and switch off T-cell surveillance in a condition as stubborn and destructive as vulvar lichen sclerosus, could this targeted fat grafting technique eventually be the key to curing other localized autoimmune or fibrotic conditions?
It is a profound possibility.
Think about it. Could we one day treat localized autoimmune attacks, whether it's happening on a patch of skin, inside a specific joint, or even in an isolated organ, not with heavy whole-body immunosuppressant drugs that wipe out your entire system and leave you vulnerable, but with a simple, targeted injection of your own intelligently processed fat cells?
That targeted immune reprogramming is the exact frontier researchers are looking at next.
Something fascinating to mull over as we watch this science evolve. Thanks for diving deep with us today.